Hi, my name is Kaylyn Rowsey, and I'm a second-year medical student at OSU COM. Today, my research is titled Lowering Pain and Inflammation Drug Cost, Evaluating the Impact of the Mark Cuban Cost Plus Drug Company Model on Medicare Savings. So for an introduction, prescription drug costs continue to rise, creating significant financial challenges for Medicare beneficiaries, particularly as the population ages. By 2060, Medicare enrollment is projected to reach 94 million, highlighting the urgent need for sustainable, cost-effective solutions. Current inefficiencies in Medicare Part D pricing, which are driven by limited cost controls and rising drug prices, exacerbate this issue. The Mark Cuban Cost Plus Drug Company offers a transparent cost plus pricing model designed to bypass intermediaries and reduce medication costs. This study explores the potential long-term savings for Medicare if the Mark Cuban pricing model was adopted, focusing on medications for managing pain and inflammation. These findings could inform future policy changes to ensure affordability and accessibility for an aging U.S. population. For our methods, we conducted a cross-sectional analysis comparing prices for 25 pain and inflammation medications on Mark Cuban's Cost Plus pricing website to Medicare Part D rates. And we focused on generic medications available in 30 and 90 pill counts. The 2022 Medicare spending dataset, which was the most recent public dataset available, was used to estimate expenditures. A conservative methodology was employed by selecting the highest cost dosages and incorporating shipping fees. Unit cost and savings were calculated using volume-adjusted quantities dispensed to Medicare beneficiaries, adhering to Cheers guidelines for transparency and reproducibility. Here's our figure 1 that shows the study selection. So we started off with 42 medications that were listed under the pain and inflammation category on the Mark Cuban Cost Plus Drug Company website. And we ended up excluding 17 for reasons such as not meeting our pricing criteria of either 30 or 90 count, and 2 were over-the-counter medications, as well as 2 more that were not accessible for comparison in the 2022 Medicare Part D spending data. So this ended up being 25 included medications. Here's our figure 2. This shows our medications that we included, and it compares Medicare pricing with the Mark Cuban Cost Plus model for both 30 count and 90 count. And as you can see, the Mark Cuban model has a lot lower prices for the majority of medications. And you can see Medicare has spent the most for celecoxib and lidocaine, and the highest savings were found in both of those medications. Here's our table 1. It's a summary of all 25 medications, the total spending for Medicare in 2022, as well as the cost in 30 count and 90 count, and the savings for the Mark Cuban Cost Plus model. And everything is totaled at the bottom. A summary of our results. First and foremost, the total Medicare expenditure was $690 million for 25 analyzed pain and inflammation medications in 2022. Estimated savings with Mark Cuban's Cost Plus model pricing was up to $344 million, a nearly 50% reduction. Considering 30 count prescriptions, there was a savings of $200 million, with 76% of the drugs showing cost reductions. And for 90 count prescriptions, there were savings of $344 million, with 96% of drugs showing cost reductions. The high savings potential, as noted before, was celecoxib, with an estimated savings of $134 million annually. Next was naproxen sodium ER, which saved $33 million annually on 30 count prescriptions. And all other medications were combined $167 million in annual savings. In conclusion, our findings demonstrate that integrating Mark Cuban's Cost Plus Drug Company's pricing model into Medicare could substantially reduce expenditures while improving medication access for beneficiaries. With savings estimated at $344 million for pain and inflammation medications alone, this model presents a scalable solution to address rising drug costs and inefficiencies in Medicare Part D. Some next steps we have noticed are, first and foremost, policy advocacy. So, engaging policymakers to consider adopting cost-plus pricing models and Medicare frameworks to reduce cost and improve medication accessibility. Next would be provider-patient communication, encouraging providers to educate patients about affordable medication options, such as those offered by Mark Cuban's cost-plus model, and also empowering patients to make cost-effective choices for their healthcare. Lastly, would be collaborative partnerships, partnering with healthcare systems, pharmacies, and insurers to implement and scale cost-plus pricing strategies would ensure broader access to affordable medications for patients. In conclusion, these are my references, and thank you.